Good morning, everybody, and welcome to our weekly forum. This is Friday, the 10th of July. We're going to start with our COVID update, and we're going to delve into the numbers. Here in the state of Florida, we have 232,000 cases with a fatality rate of a little over 4,000. It continues to grow at an alarming rate. Overnight, we saw an increase of over 8,900 cases. Here in Pinellas County, the numbers are very similar in terms of how the disease is rapidly expanding. In Pinellas County, we have 9,700 cases with 221 individuals who have lost their life. That's up nearly 428 cases overnight. It's the single largest increase we have seen in Pinellas County since way back in April when the virus had originally peaked. Pasco County, our neighboring landlocked county north of us, is at 3,000 cases and about 27 fatalities. So Pasco County continues to be sort of the shining county within the Tri-County area of Pinellas and Hillsborough, Pasco counties. In the United States, we are over 3 million cases with 133,000 fatalities. We are in day 36 of phase 2, and the governor has not indicated what his next steps are in terms of progressing to phase 3, which was originally slated to happen around the 15th of July. And so we are all anxious to see what decision he makes and how that will impact mobility and mobility rates within the state. To take a look at our community numbers, I'm going to pass it over to Leslie Haas.
Good morning. So currently in independent living, we have 18 residents who are under quarantine. Skilled nursing is 7 and assisted living is 23. It's a total of 48 in the community on quarantine for residents. For staff members in the independent living, we have 11. Skilled nursing, we have 11. And for assisted living, we have 2. For residents that are being tested for COVID or experiencing any flu-like symptoms or COVID symptoms, we have 2 in independent living, none in assisted living, and none in skilled nursing. For employees in independent living, we have 9, assisted living 1, and skilled nursing 5. For COVID confirmed cases for residents, that's 2, and for employees, that's 11. So in total for testing, for residents, we have our 2 positive, but we've had 119 negative results. And for associates, we've had our 11 positive, but 249 negative results. We want to keep seeing our negative numbers increase and be larger than our positive numbers for testing. Thank you.
Okay, thank you, Leslie, for that update. We're now going to go to Rance Macy, our administrator over in the Health Center, for an update.
Good morning, I'm Rance Macy. I'm the healthcare administrator at the Health Center. Just a quick update. We did test all the residents late last week in the Health Center, both on the ALF side and the nursing home side, and I'm happy to report they all tested negative. And we also tested all the staff last week, about 130 tests, and we did have 1 new staff member come back positive. This person was completely asymptomatic, had no idea they were sick, so we immediately sent that person home. They were not a clinical staff member. But besides that, 130 tests, only 1 new positive. We were pretty happy about that. The next round of testing will begin next Thursday, and we should have those results back the following week, probably Monday or Tuesday. Thank you.
The next thing we'd like to do this morning is review some of the changes that we made late last week in response to the continued growth in the COVID numbers across the state and here in Pinellas County. We will publish this every second Wednesday. So this is the second version of the update, and it describes what has changed and what has not. So this is the actual form that you found in your mailboxes last night or this morning. It's our phase 1. We are in stage 11 of phase 1. There are just 11 stages, and before this reoccurrence of the virus, we were just about ready to go into our final stage and move into phase 2, which is when we would have opened our dining facilities. We've had to take a step back, and so most of what you see on this will be changes. Those are the writing in green, and instead of moving forward and opening things up, we actually are retracting a little bit to make sure that we protect residents and try to prevent the spread of COVID. So the first change is with our residents. All residents are encouraged to have their temperature taken daily by the front desk. And so this is not just for individuals who are leaving the community, maybe going to have lunch with a family member. We're asking that all residents have their temperature taken daily so that we can track that. That still continues to be the most important tool and effective tool that we have in monitoring the spread of the virus and trying to make sure that we get early notification so that if you should contact the disease, we'll be able to get early preventative care. The next change in green is the pool did open with minimal restrictions in terms of the hot tub is still closed and the number of people who are allowed at any given time. Aqua size has not come back. That's a larger group activity that is still prohibited. There's been some confusion on transportation. Transportation previously was offering one-on-one shopping, and so we would put you in a car, take you up to Publix, and allow you to shop as long as it was on an individual trip basis. We've pulled back from that. What we are now doing is going back to our previous stage, and we are still offering transportation to go and do your grocery shopping, but you fill out a form, we go and do the shopping and return it to your apartment. At the end of the month, it is billed directly to your account. So that service is available for all residents, and there are forms at the sign-up tables in both buildings. The town hall, which was reopened for larger group meetings, we've pulled back from that as well. And so now small group meetings, 15 or fewer, can be relocated to the town hall and scheduled through Tiffany. In terms of our visitors, we have secured all the side doors to create a single source access at our front entry. I know this is a very unpopular decision, but it is something we felt was necessary to give us better control. And the thinking behind that is, let's say I'm doing 150 door entries on a daily basis, people coming and going. I don't know who those individuals are, but I can tell when that door has been opened. If I can reduce that from 150 down to 30 a day, then that means I've made you 60-70% safer because I've reduced the number of potential exposures. By having people go through a single source entry, I'm able to capture your information, get your temperature, and it gives us better control and ultimately makes all of us safer. Additional screening capabilities have been added to the front desk, and you probably have noticed the card tables in both entries. That's designed to remind individuals of just how important it is to make sure that their temperatures are being checked on a daily basis. And this is a way of just putting a greater emphasis on that change. Okay, next up is Ricky with our food and beverage
Good
update.
afternoon, happy Friday. I just wanted to give you an update. I know most of you seen the menu, but we got a lot of exciting things coming up in the on the next week's menu. We're gonna have a croissant egg sandwich. We're gonna be offering pancakes, Belgian waffles. At lunchtime through the tavern / breezeway, we'll have grilled hot dogs, pressed Cuban, chicken quesadillas, a Reuben sandwich. We'll also be offering at the night meal on Wednesday will be prime rib, and then we're going to be passing out chocolate or vanilla Haagen-Dazs cups. Residents that don't know what an airline chicken breast is, it's basically we're serving an 8-ounce chicken breast and it has a bone attached, but no bones on the outside of the chicken breast, just a little French bone on it. It's more for aesthetics. Thank you.
My name is Doran Perez. I'm the maintenance director. I just want to give you a quick update on the generator. I know we had a failure last time, 2 weeks ago. We got a temporary one for now, and we did place an order for a new one. It should be being installed in 5 to 6 weeks. And other hands, I just want to introduce Michael. He's our new team member, and he's going to be the new supervisor in our department.
Hello, everybody.
All right, and I'll pass it up to Lori.
Hey, everybody. I just wanted to let you know that your voice was heard. We've had some issues brought to our attention on the Monday, Wednesday, and Friday COVID training shows aired on 732. There has been some additional training done, and hopefully those issues will be taken care of. And please wear your masks, wear your masks, wear your masks. Now, Jesse, what do you have to share with us today?
Jesse Rosalie, your EVS director. I have some great news to share with all of you. We've actually got word that we will receive the ultraviolet machine, which is supposed to disinfect your apartment in about 10 minutes. That machine should be arriving anytime soon, perhaps next week. So watch out for that machine to be around. Thank you.
Good morning, Regency Oaks. I just wanted to reiterate what Brent mentioned earlier with the changes with programs. Transportation is still doing the shopping trips for our residents as a convenience. We just wanted to make sure to emphasize that. I know a few people weren't aware of that, that we're still doing that for residents. If you stop by Tuck's desk in the North Building or either South or North, if you stop by the trip table in the North or the South Building, you can pick up your shopping list. And as always, please be as specific as possible. Well, we are encouraging residents to please use this service because it's so handy and you don't have to be out shopping, and we'll make sure you get your groceries right to your front door. Also, we have heard all of our residents, they give us great tips on our channel 732. We are daily updating that system to put as much new information on there as possible, as well as we always appreciate any feedback from our residents. I would like to thank Ms. Bunt as well as Terry Ross. They always give me great feedback on how I can change it up and make sure it's accessible by all of our residents. Thank you.
Good morning. Amy Watt, Director of Sales and Marketing. We had a wonderful quarter last quarter. We ended June with 14 closes to a budget of 13, and we have several new residents that are getting ready to move in this month. This week alone, Linda Lindsay moved into A107. If you see her, please welcome her. And thank you to all of our residents who have helped us with our marketing efforts over the last month. We greatly appreciate it.
Hello, I'm Sandra Novotko, Human Resources Director. We are continually checking on associates who may have symptoms of COVID-19, as well as following up with any positive associates, ensuring that they are negative before they come back on campus. We are doing our best to ensure the safety of our residents as well as staff. Thank you.
I wanted to talk about our isolations and quarantines here at Regency Oaks for our residents. So if you have been exposed to someone that's positive or you yourself have tested positive, you are under strict isolation. This is where you are confined to your apartment. We come up and take temperature checks and symptom checks to make sure if you are okay, as well as to document everything. You are not allowed to leave your apartment to go and retrieve any food from our dining areas. We will have all the meals delivered to you during your quarantine time. Now, if you are
All right, well, thank you very much for joining us this afternoon, and we wanted to end our presentation a little differently this week. I'm going to share with you what I'm grateful for, and I'm going to ask a couple of staff members to do the same. I'm very grateful for the fact that all of our residents have been so supportive and cooperative in helping us make sure that these difficult steps that are paying off and yielding such positive results. I know they're difficult, and I am so grateful that you have been a part of us and have been working with us to make sure that all of our residents are safe. Thank you. Amy, what are you grateful for this morning?
And I am especially grateful that I get to come to work every day with such a wonderful team of associates and residents that care about each other so much. I am very grateful for that.
Phil, I'm really thankful that we can actually come in every single day and provide the residents with a nutritious meal to allow them safety.
Good morning, everyone. Hope everyone is staying safe and healthy. Just wanted to say thank you for following all the guidelines. I know it's very difficult for all of you and your families. We have a great team of associates here that are doing the same thing to keep you safe and us safe. Call me if you need anything. I'm happy to meet with you over the phone. We can meet in my office if we're social distancing. So thank you during these very difficult times. We really do appreciate you, and please don't hesitate to call me if you need anything at all. Thank you.
Very grateful to soon, in October, having my first child. At this moment, everything has been smooth. Wife is really healthy, and the baby's treating her really well. So we cannot wait to welcome the little one in October.